think that that is the most important thing for people with HIV. Now that they're no longer got this death sentence hanging over them, with great treatment, they can live a near normal life expectancy, and that should be of good quality. My name's Jenny Hoy, and I'm an infectious diseases physician, head of the Victorian HIV service at the Alfred. And I've been involved in HIV care and research since the mid-80s, from the early days at Fairfield Hospital to when it closed and moved to the Alfred. My relationship with Living Positive Victoria has been over a number of years, particularly around the Phoenix program, where I come in and discuss HIV 101 with people that have been recently diagnosed with HIV and dispel the myths of treatment and the HIV journey over time. So aging well with HIV means optimising your health to the best it can be. And that might involve additional medication, might involve stopping smoking, cutting down on the alcohol, exercising. But all of these things will optimise your health and make you feel better and embrace the world and living with the best quality of life. So as people are ageing with HIV and with the great treatment that we have today that is potent and really well tolerated with minimal adverse effects, people are able to live longer than they expected to when they were first diagnosed many, many years ago. But with that ageing comes age-associated conditions that people in the general community also experience. People with HIV seem to experience more of these conditions and perhaps experience them at an earlier age. And for that reason, the management of HIV has changed from just doing an HIV viral load, doing a CD4 cell count, to screening and management of age-associated conditions, like making sure your blood pressure is well controlled, like making sure you stop smoking, making sure that you reduce your alcohol intake. And in general, exercise, healthy diet, all of these things will contribute to aging well with HIV. So some of the barriers to healthy ageing are factors such as smoking. Now, in the early days, when patients smoked, we didn't encourage them to stop smoking because their life expectancy wasn't such that they would experience smoking-related disorders. But today, yes, we need to attend to reducing alcohol intake, quitting smoking, looking at recreational drug use, exercise, nutrition, ensuring that those factors will all be in a good place for people to age well. So some of the barriers to aging can also be not attending healthcare for monitoring of blood pressure, cholesterol, having the usual cancer screening that the general population has. Some people miss out on that because they only attend an HIV specialist who may not ensure that all of these usual screening procedures are done. So barriers can be different. They were perhaps different earlier in the 1980s and early 90s to what they are today. And we would encourage everyone to have a great GP as well as their HIV specialist to monitor all of the aging associated diseases that the general population have. people with HIV who attend mainly HIV specialist clinics, who may be referred to other specialists to look at their heart disease or their liver disease or their kidney disease, they find that they're seeing multiple specialists and they don't feel like their care is being coordinated in any way. This is where a good GP is important, because a GP can coordinate that care and ensure ongoing good communication between the specialist and the GP, and hopefully between specialist and specialist. So I think coordination of care becomes really important as people with HIV age and find they have multiple doctors that they're attending. What would I tell my younger self in the year 2000, when we had been managing HIV for only 12 to 15 years, when we had such poor outcomes for our patients because we didn't have the tools to treat them, we didn't have the medication that was effective, and I felt a continuous failure for my patients. I would tell myself that research was going to make a difference, that research was going to find better treatments and better outcomes for people with HIV, that a lot of the research that we did also identified new syndromes and new adverse effects from some of the treatments that we then tried to reverse, successful sometimes, not always. But I've aged with my patients from those early days. And in 2000, I was also a mother of 2 primary school children. And I didn't have a lot of time for myself. I was wearing 3 hats most of the time. And I think what I should tell myself today, as well as back in 2000, is to take time out for me, to look after my own health so that I can continue doing what I'm doing, which is something that I just love, and that is helping people with HIV to age well.